Cooperation and Coordination Agency TIKA through C3G organization Cancer Confrontation, Care and Consolation the Gambia on Tuesday handed over cervical cancer screening and diagnostic laboratory and among other equipment to the Bundung Maternal and Child Health Hospital. During the handing over ceremony, the program manager of the National Cancer Control Program, Dr. Keba Bojang, said that the equipment being handed over are specifically for screening and early detection of cervical cancer, adding that as a country it will greatly target the global attainment of the elimination for cervical cancer by 2030.
1970 target means is that to make sure that by 2030, 90% of our girls by the age of 15 are fully vaccinated against HPV. And 70% of women are screened with high-performance tests by 35 years and again by 45 years. And 90% of women identified with cervical cancer receive treatment.
The Chief Executive Officer of the Bundung Maternal Hospital, Mamadi Jam, during his speech said that the commemoration of the annual fight against cancer, which was slated in October, was a turning point and motivation for the hospital to establish a clinic for rooted breast and cervical cancer screening.
That resulted us to mobilize some basic equipment and supplies, including the procurement of carbon dioxide cylinders to facilitate cryotherapy. From 2022 to date, the clinic has been operational Mondays to Fridays, and up to 785 women were screened at the clinic.
The Turkish Cooperation and Coordination Agency's coordinator, Tulbeya, noted that it is the first of its kind for the history of Bundung Maternal Hospital to have a lab for screening and detection for cervical cancer, and which the equipment are suitable for the treatment of breast cancer, adding that she is overwhelmed to be the first providers of certain facilities within the hospital.
As you may be aware, cervical cancer is the fourth most common cancer in women globally. Each year, thousands of new cases are registered, most of which are deadly cases. The mortality rate among cervical cancer patients is higher in low and middle income countries. This is due to the lack of access to HPV vaccination, cervical screening, and treatment services. This project is aimed at equipping the hospital with the necessary equipments to provide regular and reliable cervical screening and treatments of precancers.
In his speech, Olga Bermek, the Republic of Turkey ambassador to Banjul, stated that these facilities will benefit many patients on the risk of cervical cancer, and they are aware of the Gambia Ministry of Health in developing the capacity of hospitals in terms of cervical cancer treatment.
We all know that one of the biggest challenges we face in cancer treatment is ensuring timely access to services for the patients for early diagnosis. With this valuable project of TIKA, the patients will be able to deal directly with this challenge in a timely manner owing to this clinic.
The representative from the Ministry of Health and Permanent Secretary, Professor Omar Jah Jr., said that from statistics that every 1,000 women in the Gambia, 98 may have cervical cancer, and for every 1,000 women with those cancers, 57 may die, and that this occasion marking the handing over of cervical cancer screening equipment and opening of the clinic are from concerned and committed institutions
and individuals, but most importantly, C3G, TIKA, and the Turkish government. For that, I express my infinite gratitude to you all. Available statistics informed us that cervical cancer is the most common cancer affecting women in sub-Saharan Africa. Cervical cancer is mainly associated with the human papilloma virus, which is often sexually transmitted. In the Gambia, cervical cancer is the leading cause of gynecological cancer, accounting for 32% of all cancers among women.
The facilities handed over at the event to Bundung Maternal and Child Health Hospital worth $1,375, and the list of the facilities were coloscopy 1 piece, transvaginal ultrasound machine 1 piece, gynae examination bed 1 piece, biopsy forceps 20 pieces, disposable speculums 500 pieces, thermocoagulator 1 piece, cytobrush 500 pieces, iris spatula 500 pieces, and tan examination light 1 piece. For Voice Out Digital, I am Adama Jang Jalo.